per year. And that is 1 in 10 people affected in the US, which is approximately 30 million Americans. And unfortunately, only 200 of these diseases have an FDA approval for treatment. Now, there are many challenges faced by the patients within this community. Because they are so isolated, they have found that they are having problems finding doctors, finding treatment, and even getting a diagnosis. Many patients don't even know what they have, and they are within a group of people as undiagnosed, and they have to attend clinical trials. They could possibly be 50 miles away from where they need to go. They have problems with travel due to their medical issues. There's a lot of problems that they face, and sometimes they don't even know who to talk to with their just day-to-day life. Because these people are considered rare because of their disorder, they unfortunately don't have many medical professionals that they could speak to, because these medical professionals are not educated enough on the actual disease. Some diseases are were just found, and they do not have anything to work off of to understand what their problem is. This is also a global health challenge. Now, a voice is needed for these people that are faced with this daily challenge of just living a normal life. What NORD does is they give that voice to these people. NORD is just one organization in this huge environment of people that need a lot of help. And they're considered an umbrella organization, and they provide education, advocacy. Down in DC, they work with a lot of government officials to try to get legislation enacted in order to develop drugs for these patients. Unfortunately, within this community, when you have a disease that is only affected by less than 200,000 people, the drug companies do not want to develop a drug if they cannot see a profit for it. So the government will provide incentives to these companies so that they will create this treatment. So then NORD also connects patients with each other. There are patient meetings and assistance to them, either financial or even just psychological, or connecting them with doctors, and support and innovation. So the major challenges that they have to address, I believe NORD is doing that, but they are only one organization that is supporting an entire country, and that's just in the US. There is a partnership with Euroris in Europe, in France, but they currently are not working very closely together, but they're just building a partnership with them. So I've seen many patients via social networks trying to get information from around the world. Unfortunately, they don't have any kind of organization within their home country that can provide assistance to them. And do you have any questions?
Yes, I do.
Okay.
Give us a couple of examples of rare diseases that you're talking about here.
Sure. Many of them are very difficult to pronounce. MPS 6, which is monopolysaccharidosis. I went to several patient meetings and got to meet several patients. And this disease, many patients are in wheelchairs. They can't walk. Another disease is PNH. They're all with acronyms, and because they're so long, most of us can't pronounce them.